Ischemia is a serious medical condition that occurs when blood flow to a part of the body is restricted. This restricted blood flow means that the affected tissues and organs don't receive enough oxygen and nutrients to function properly. Imagine a garden hose with a kink in it. The water supply is disrupted, and the plants downstream start to wither. Similarly, when blood flow is compromised in our bodies, our cells begin to suffer. Ischemia can affect various parts of the body, but the most common types are cardiac ischemia, cerebral ischemia, and peripheral ischemia. Prolonged ischemia can lead to severe complications, including heart attack, stroke, and even tissue death. Understanding the causes, symptoms, and treatment options for ischemia is crucial for early detection and effective management. The most common cause of ischemia is atherosclerosis, a condition in which plaque builds up inside the arteries, narrowing them and hindering blood flow. Think of it like rust accumulating inside a pipe, gradually constricting the flow of water. Other causes include blood clots, which can completely block an artery, and conditions that reduce blood volume, such as dehydration or severe bleeding. Cardiac ischemia, often associated with coronary artery disease, occurs when the heart muscle doesn't receive enough blood. Cerebral ischemia, a leading cause of stroke, happens when blood flow to the brain is disrupted. Peripheral ischemia affects the limbs, commonly the legs and feet, causing pain and cramping, especially during activity. Understanding the different types of ischemia helps healthcare professionals tailor treatment plans specific to the affected area. The symptoms of ischemia vary depending on the location and severity of the reduced blood flow. However, some common warning signs include chest pain, shortness of breath, dizziness, weakness, numbness, and pain in the affected limb. Recognizing these symptoms early is crucial for seeking prompt medical attention. If you experience sudden chest pain, especially if it radiates to your arm or jaw, accompanied by shortness of breath, dizziness, or nausea, call emergency services immediately. These could be signs of a heart attack. Similarly, sudden weakness, numbness, or paralysis on one side of the body, along with difficulty speaking or understanding speech, could indicate a stroke. Treating ischemia involves restoring blood flow to the affected area and addressing the underlying cause. This may include medications to prevent blood clots, lower cholesterol, or control blood pressure. In some cases, procedures such as angioplasty or bypass surgery may be necessary to open up blocked arteries. Living a heart-healthy lifestyle is crucial for preventing ischemia. This includes maintaining a healthy weight, exercising regularly, eating a balanced diet low in saturated and trans fats, quitting smoking, and managing stress. Regular checkups with your doctor are also essential for monitoring your risk factors and detecting any signs of ischemia early on.